You probably get the common cold all the time, but have you stopped to think about it? Have you thought about how it spreads? There is more to the common cold than you may realize. This paper slide video will tell you more about the things you may not know about the common cold. The scientific name for the common cold is rhinopharyngitis. Rhinopharyngitis is defined as an inflammation of the nasal and pharyngeal mucous membranes. There are 99 recognized types of rhinovirus that affect humans. The common cold is caused by a virus. Viruses are very small, thousands of times smaller than cells. They are made up of a strand of DNA or RNA surrounded by a capsid, which is a protein coating. The capsid is sometimes surrounded by a membrane. Viruses need a living host cell to live and multiply. The DNA or RNA the virus injects into the cell causes the cell to make more viruses. A lot of times, viruses kill or damage the cells they infect, which will eventually make you feel sick. The cold viruses attach to the lining of your throat and nose. Your body sends in white blood cells. This causes inflammation and increased mucus production. I've already mentioned that viruses use the host cells to make more viruses. This new virus infects other cells and spreads throughout your body. They can also spread to other people. Insects, mites, and animal waste can spread it. Also, if you were to touch something that a lot of people have touched, such as a doorknob or keyboard, and then stick your fingers in your nose or mouth, you could get the cold. And touching other people can spread the cold. When someone sneezes, they release the virus into the air. If you were to breathe in those viruses, you could get the common cold. If you're very fatigued, have emotional distress, or have allergies with nose and throat symptoms, you could be at increased risk for getting the virus. The common cold can spread fast. One estimate says that Americans suffer 1 billion colds each year. How do you know if you have the common cold? There are plenty of symptoms. An itching or sore throat, sneezing, nasal congestion, which is a stuffy nose, mucus drainage, watery eyes, headaches, and body aches are symptoms. Fatigue and a mild cough are also symptoms. The symptoms start from 1 to 3 days after you're infected and last from about 3 to 7 days. How can you treat the common cold? Don't use antibiotics. They won't help. You can use anti-cough or anti-congesting medicine to help relieve the symptoms. There's no real treatment, though. This is luckily not a serious illness. There are plenty of ways you can prevent from getting the common cold. Probably the most obvious way is to wash your hands, especially before you eat. Remember, touching things other people have touched and putting your fingers in your mouth can make you sick, so wash your hands to get the virus off before you eat. Also, avoid contact with people who are sick and refrain from touching animal waste. We would like to thank all of our sources. This video is created by TE, LT, LM, and SR.